So we're going to talk about cat medical on a shoestring budget. And it all starts with our intake process. So for normal intake, run-of-the-mill routine cats coming in, this is what our intake process looks like, and I think that is actually Dr. Bars in that photograph. One of the things that's somewhat controversial is that a lot of shelters immediately hold cats for a certain quarantine time when they first get these cats before they'll put them in Gen Pop. And we have seen, and there are studies that back this, that we're doing more harm than good by automatically quarantining cats upon intake. It's much better to spend a couple more minutes up front and do a quality intake exam and move those cats immediately to adoption thereafter than to put them into quarantine time for a few days and see if they break with anything. So if you haven't heard this before, if you hold a cat indefinitely at your shelter, is she going to get sick? Yeah. We know that the number one thing that makes cats sick is us, the shelter. So give them a good intake exam when they first arrive, and then move them immediately to adoptions or wherever they're going. For us, that looks like an FVRCP immediately upon intake. If they're due, there is no exceptions to this, 0. So I don't care if you are a feral or you're a fractious cat. If you're a Tasmanian devil inside of a carrier, you are getting an FVRCP vaccine come hell or high water.
And let me just interject here. So a lot of vets will say there's no reason to vaccinate if they're really sick. Here, we really don't have any other option. If we don't vaccinate, they're going to get sick. So literally, we vaccinate no matter what.
And that's for FVRCP, not necessarily for rabies. FVRCP, everything is getting it on intake, period. Everybody on intake is going to get flea control, whatever we have donated. Strongid, so pyrantel. Everybody's going to get a microchip on intake unless they're feral, and then they'll get some of this during surgery, but they're always going to get an FVRCP. Rabies vaccine, and then they're going to get a good physical examination, and so a good physical examination includes weight, checking the mouth, checking the ears, checking the mouth for ulcers, what do their teeth look like, checking their age, checking their eyes, a good once over, not just a cursory glance. And it should include a Woods lamp exam for ringworm. Almost no matter where you are in the country, your intake exam should include a Woods lamp exam for ringworm, because you're going to have much bigger problems down the road if you don't catch ringworm and then you put cat in Gen Pop and now you have a ringworm outbreak. A Woods lamp exam costs nothing to perform on intake, so go ahead and do it even if you're in Alaska and you see ringworm once or twice a year. And then the last thing that we include during our intake process is an FIV-FELV combo test, but I have a little asterisk on this one to remind everybody that we are only combo testing because we have guaranteed every single cat a live outcome regardless of how they test. We are using it as a diagnostic tool, not a culling tool. So we're only testing so that we can provide cat the best possible medical care based on his or her individual needs. We're not testing so that we can say, okay, go ahead and euthanize that cat. So unless you can make that guarantee that says you pop positive for FIV or leukemia and we guarantee you life just the same, don't test. But that's what our intake process looks like at Austin Pets Live. Oh no. Oh, it kind of works. It works slowly. Our wellness schedule, every cat at APA gets an FVRCP vaccine every 2 weeks from the age of 4 weeks all the way up to 16 weeks or 4 months. You can start it at 6 weeks of age instead of 4 if your cats are very safe in a non-high-risk environment. In our nursery, for example, that's a high-risk environment because it's a room full of neonates, right, who carry everything in the world. If you're coming from municipal animal control, that's a high-risk environment. If you're living in a foster home, you're nice and safe with 1 or 2 other cats, you can maybe start FVRCP at 6 weeks, but for us, we usually start at 4 weeks when cat or kitten is coming from a high-risk environment. There's no safety issue to starting it at 4 weeks versus 6. The only downside is that 4 weeks, the vaccine may just not work as well. So there's not any harm to giving it at 4. Adults will get a total of 2 FVRCPs. We deworm every 14 to 30 days, typically with just your pyrantel strongid. Flea control every 30 days, and then we do daily wellness rounds, and those are not a vet duty. So daily wellness round is usually performed by our critical care staff or our cat manager on duty, and this is just going around making sure that we put eyes and ears on everyone. We have a plan for them. Nothing it needs to be brought to DVM attention. We're just putting eyes and ears on cats. This is not a DVM duty. As Dr. Bars here will tell us, she does not get to do fun things like daily rounds. We are paying Dr. Bars a lot of money. and her time needs to be spent doing things that only no one else can do. Lots of other people can do daily rounds. I don't want Dr. Bars. I want her in the clinic doing surgery, removing body parts on something that no one else can do. So she does not do daily rounds for us. So how is medical care different in a no-kill city? I should have prefaced this by saying there'd be some gory photos along the way. Hopefully, maybe graphic photos, but not gory. We treat every single cat that comes in as if she's going to live. So for us, it means when we open the box and there's a cat inside of it, we assume that you're going to live, and we're going to do everything in our power to treat you as if you're going to live. We don't assume, oh, well, this cat might die, so we're not going to vaccinate, so we save that $1 to vaccinate. We assume that you're going to live, and we're going to treat you from the moment you arrive as if you're going to live. We don't say, oh, let's combo test this cat first before we put any resources into him or her. Because if she's leukemia positive, maybe we don't want to save. We assume, I don't care what that test how that cat tests on a combo test, we're going to go ahead and treat as if she's going to live no matter what. Our goal is to save all salvageable cats, no matter what the problem is. And we systemize our treatments to save DVM time by using a lot of protocols. So I don't want Dr. Bars seeing URI cats. I don't want her seeing diarrhea. I don't want her seeing elementary things that a tech can deal with. What Dr. Bars and her team have done is say, this is how we treat URI, this is how we treat diarrhea, and then you employ a team of techs to go forward and do the things so that Dr. Bars, again, is only spent in surgery doing fancy things, removing body parts, and fun things that only a DVM can do. But having protocols for all those minor illnesses and ailments that a tech can see frees up my time to have Dr. Bars seeing only the things that she really needs to be seeing. The second thing is getting these cats out as fast as humanly possible. What is the greatest risk for cats' lives in this country? Who kills more cats than anyone? Shelters. We are the #1 killer of cats in this country, those of us sitting in this room and our colleagues. We kill more cats than anything else in the world. They need to get out of our hands. We often think that we're doing these cats a wonderful service by taking them in and they need sheltering and whatnot, but equally they need to get out of our care as soon as humanly possible. The longer that we have cats in custody, the more stress that they get, the sicker that they get. Oftentimes they will never heal in-house. So we have to get these cats out as fast as humanly possible. We are not going to wait until cat is 100% to get them out the door, not to adopt her and not to foster. People who are coming to your shelter to adopt a cat are not looking for a 100% positive, pure cat that has no sickness or no ailments. The word shelter inherently implies that we are a refugee camp, that we are taking in those in need, and we are putting them back out. Give people a chance to take home a cat with a URI. Send them home with the treatment. Send them to foster to get the rest of the treatment. You do not need to house these cats inside your shelter until they are 100% before allowing them to go back out into the world. And so that is a huge take home for you guys, is that the longer you keep a cat in-house, the sicker she's going to get. Sometimes the best thing we can do for a cat in the world is get them out from under our care and alleviate that stress. Because, of course, a stressed cat is what? A sick cat. So let's talk really briefly about the difference between euthanasia and kill. The definition of euthanasia, and this is a word that we have really bastardized in this country. Euthanasia is the deliberate ending of a life from incurable, painful, and a deadly condition. For reasons of mercy, because without euthanasia, natural death would be preceded by extreme suffering. This is a true act of mercy. The definition of kill is the deliberate ending of a life that is not suffering from an incurable, painful, deadly condition. There's a big difference. Do we all understand how we have just really twisted the word euthanasia in this country? Big difference between euthanasia and kill. The other thing I want to point out is that oftentimes we'll hear, we euthanize cat because she was suffering. Suffering is inevitable in life. For animals, for humans, for everyone. Suffering is inevitable at points in time, right? You've all suffered at some point in your life, I assume. Did we euthanize you when you broke a leg when you were in elementary school and fell out of the tree? Of course not. But we might euthanize a cat because she fell out of a tree and broke a leg and she's suffering. So we reject that. We go, suffering is inevitable. we're going to alleviate the suffering. Do you have a chance to overcome suffering and lead a normal quality of life? If so, that's not euthanasia, that's kill. If we were to kill cat who fell out of a tree and broke a leg. And the other thing is that all life will end. Maybe we are looking at a cat, well, she has feline leukemia, so she's only going to live a few years, we should just go ahead and euthanize her. By that logic, we should go ahead and euthanize everybody, because all life is going to end at some point. And none of us know when, most of us, unless you're some sort of a gypsy fortune teller. But all life includes suffering, and every life is going to end, so we don't take that into account when we are looking at euthanasia versus kill definitions.
Okay, so I'm going to go into some medical things here. So we have two options when we have a sick animal. We can either use a limited amount of funds over a bunch of animals, or we can use some funds over a few animals. The no-kill way would be to save more animals, unlimited funds. So you have to learn how to spread all those funds in order to give these animals a good quality of life and get them adopted. So to do this, you have to triage the cases. Number one, you have to be flexible with your drug usage, and there's always options. For instance, as an antiemetic to stop vomiting, you could either use a cheap version, which would be Reglan or metoclopramide, or you could use Cerenia, which is more expensive. Yes, Cerenia is better, but Reglan may do what you need it to do. So, if you don't have the money to spend on Cerenia, go with Reglan and see what happens. The other thing is pain medications. There's buprenorphine, which is great. It is expensive. You can also use meloxicam, which is a non-steroidal anti-inflammatory. You have to be careful with its usage as far as making sure it's the right dose and whatnot, but it'll relieve pain and lower a fever, and it's cheaper than buprenorphine. You want to make sure that you spend spend the most money on the diseases and issues that are going to have lifelong pain if you don't correct them. So triaging those issues. And the way we do this is we treat the symptoms, we treat what we see. So if you have a perfectly normal cat that somebody says, is doing A, B, and C, but you see it and it's not doing any of those things, and it's eating and drinking and doing great, don't treat it. A lot of times we get cats with a history of doing multiple things, but then we get it and it's totally fine. So we like to observe the cat when we get it and then treat what we see. So this, for instance, this cat has swelling over its nose. There are a few things that can cause that. There's trauma. There's also different types of infections, such as fungal, and that's most likely what this cat has. So instead of doing an expensive test, a fungal test to see if it is fungus, we just start treating with an antifungal, and if it is, you'll notice it working within a week. So, we're not spending $30 or whatnot on a fungal test. The antifungal it can be more expensive than other medications, but it's cheaper than doing the test. And, if you see improvement, then you just continue that antifungal until it's totally resolved and you're good. Time is your biggest friend. I can't tell you how many animals I get in, and when I first started, and I didn't think that this animal would get better. And, I put it on pain meds, antibiotics, and with time, they were 100%. And it was just because I never had seen that before. But with that being said, time, as long as their pain is being controlled, you're controlling any infection that's going on, and their quality of life is there, give them time. And so ways you can save money. We rely on donations for most things, even medications, and a lot of people are against that, but we get medications donated that are great. some are not even expired, and they're really expensive medications that we otherwise wouldn't have. And so we save those for, our most challenging cases that we need them in. So, save drugs that are donated. Any kind of supplies, go through them, see what you can use, what you can't use. You'd be surprised. I actually have a bin that says, like Dr. B's thing she will never use, which my techs put on it, because I have random things in there, and it's kind of like just my magic box that I go to when I need to correct something or do a crazy surgery or, pop some kind of crazy abscess. So you'd be surprised what you can use. Keep all the donations, just go through them. Use your volunteers. Volunteers are awesome. You have to create an organized way of using them, so protocols and whatnot, so that they're not going to tax your clinic or system, but will actually help you. But once you've got that all down, they are amazing. And honestly, you can't start a shelter without volunteers. I mean, we were volunteer-based back, 6 years ago or something. As far as medications go, we break them up. So like a whole tube of eye ointment, antibiotic or whatnot, we don't just give that whole ointment that tube to an animal. We break it up into like a 1 milliliter syringe and then give it, because otherwise you waste so much, and then you're going to go through eye meds, much more quickly. Same thing with flea meds. There's a dosing regimen you can find, protocols for like Frontline and that kind of thing, where you don't have to use the whole tube of what the manufacturer says. You can break that up and use it amongst more animals. Always look for alternatives to expensive medications and foods. Just because there's a prescription diet out there, for one thing, doesn't mean you have to feed that. As far as medications go, there are always alternatives as far as, like, say, heart medications for heart failure. For example, our treatment protocol at APA, instead of going with the expensive medications such as pimobendin, we will just treat with furosemide, which helps the heart to pump the blood and, get the excess fluid out of the system. And, it's not, if you went to a private veterinarian, they're going to say the gold standard is the expensive pimobendin, enalapril, and furosemide. But, we're trying to do what the average pet owner would do. So if the average pet owner said, I could only spend $30 a month versus $100, the furosemide is the way to go. We're trying to just keep the quality of life, not extend their life. Both would be great, but, we do what we can do. So quality is the key. And then foster homes, like Monica was saying, everything's less stressed when they're in a home. They get tended to more often. Foster's the way to go if you can, get them out to foster.
So I'm going to mention really quick, this photo up here is of my foster right now, Sam, and I would be remiss if I didn't talk about him.
Princess Sam.
Princess Sam. He's my perma-foster in that he will be with me forever. No one can afford to adopt this cat, and so he is my permanent foster. Also, I just won't let him go is the honest answer, and I don't want to pay for him. Samuel here is, by my calculations, the most expensive cat APA has ever taken in. We would have had we paid for him, we would probably have expended $15,000 or $20,000 by now for his care. He has never cost APA 1 cent because he has crowdsourced all of his funding. He was an abused and neglected cruelty case. He was a community cat who came in with a giant ear polyp. He had 3 ortho ear surgeries to remove an ear polyp. Then he had 2 full mouth extractions, and then he had MRSA, and then his skin sloughs off, and he's just a chronic, nightmare of a cat. But he has still not cost APA 1 cent because we have crowdsourced all of his funding through chip-ins and through people who saw him on the street and they actually created a Facebook page called Save Sam, and they continue to pay his bills for whatever he needs. So even though he is a $15,000 to $20,000 APA cat, he's not cost us anything because we asked the community for support in that. And we will probably have about 5 medical chip-ins going a week, or GoFundMes, for these individual animals who need care above and beyond what we would normally be able to provide. And so with those animals, say you have a cat who needs some bizarre ortho surgery, we will actually not book the ortho surgery until that chip-in or fund is met, and then we are able to proceed.
So things not to skimp on. Pain, if you have any indication that an animal is in pain, just give it pain meds. Wounds, wounds are easy, keep them clean, get them on some antibiotics. Wounds heal up amazingly. The key things to treat ASAP are anorexia, so especially, cats, when they don't eat, they can go downhill in a matter of 48 hours. So if we have a protocol, an anorexia protocol at APA, so if a cat isn't eating for 24 hours, we offer it a buffet of all different types of food. You know how picky they can be. Warm up some food, give them pate, give them chunks and gravy. Royal Canine baby cat kibble we call it kitty crack. Give them all that stuff. If they're still not eating, we start sub-Q fluids, give them an appetite stimulant like mirtazapine, cyproheptadine, something like that. So, and then force feeding. If we can't find anything else obviously wrong, maybe it's just stress, we'll start force feeding. Eyes are another thing, if that patient has the ability to keep its sight, we want to do everything we can to save that. We will actually make in-house gentamicin ophthalmic drops, which you can mix gentamicin injectable with some saline and do that, and that's a really cheap way to get some antibiotic drops. Otherwise, you can use donated ophthalmic ointment or drops that you get. And then neonate illness, that's a huge one, because these little kittens, they can go downhill quick. So if you wait on them, it'll be too late. So if we have, anything, it's not even just neonates, it's really anything like a 1.5 pounds or less, because those are the guys that really tank. They'll get hypoglycemic if they don't eat and that kind of thing. We will actually start Baytril, which is a very strong antibiotic. But if you have a kitten that's not eating, you've tried everything, you're force feeding it, it's just still losing weight, we will start Baytril, and we usually do it subcutaneously, so under the skin with some fluids. And we'll do that for 3 to 5 days. A lot of these little kittens, and we don't know exactly what's going on, but they'll have just a systemic infection. Who knows, what's going on, but that will turn them around. If they're vomiting, the other thing you could do if you have Serenia, or even if they're not eating, you can give them Serenia. Now that's if you can afford that. You don't have to do that, but that's a nice add-on. So the most common reasons that these cats show up, I can't tell you the amount of time that we get hit by car cats. So many. You have a cat that comes in, its head is extremely swollen, its eye is popped out, blood coming from the mouth, it's lateral. We have a very good success rate with these guys. Of course, we can give IV intravenous fluids and that kind of thing, but the main thing with them is controlling their pain, like we said, giving them an anti-inflammatory to help with the swelling. Okay. I apparently jumped to that one. Let's see, you kind of messed me up there. This guy, for instance, he came in, you could see his eyes popped out. We gave him some oxygen, we sedated him, and we had the ability to take out his eye right then and there, so that was good. You might not, and if you don't, that's fine. Again, if you just get the pain meds on board, get them stabilized. If you don't have IV fluids, do sub-Q fluids. These guys are really resilient. If they're going to make it, usually they do. Otherwise, they can go both ways. So you just have to monitor them. To get into some more in-depth treatment, which if you have a vet on staff, they would probably do this, but these guys with head trauma, you can give something to help reduce the brain swelling. So some hypertonic saline, you can give them in the vein, and that'll help do that, or mannitol. This guy was a case that came in, and you can see down there on the right, he's eating, and his eye was taken out, and he did extremely well. You may have to put a feeding tube in these guys to help give them food while they're recovering, but
Yeah, this was a cat we called Super Sullivan. I think he had a broken jaw, so I think we did put a feeding tube in him after you rewired his jaw shut.
Yeah, so they may need a few surgeries, but at the same time, just stabilizing them, if you don't have the ability to do surgery right away, is the key. Because, you know, in 2 to 3 days, that swelling will come down and they'll look like a different cat. Let me go back to this because I jumped.
Sorry, I jumped you.
Oh, I can't go back. Okay. So with these cats, when they have trauma, you want to monitor them. So, you know, give them the pain meds as long as they're not in pain. So she's really.
Do you want to go back or
screwing
not?
me up here.
I got some side eye.
So the main reasons these cats are coming to shelter are the trauma. Yes, we're saying hit by car cats. Other diseases such as skin disease, which skin disease is so easily treatable that, you know, you need to be doing that. So that's all I wanted to say about that. So as far as the trauma cats, you want to control their pain. There are some pain meds, you know, there's buprenorphine, like we might have talked about, that's the more expensive pain medication. There are cheaper ones out there. Gabapentin is really good, and it's not controlled. It's working its way to being controlled, but it's good for pain involved with the nerves. So a lot of back conditions, really any kind of pain. We use it all the time. It doesn't have as much effect on the kidneys, so that's why it's also good. And it also helps their behavior. So a lot of times if you're going to do a procedure to a cat, I don't know, say take a bandage off or something, and they're a little more fractious, if you give them gabapentin about an hour before you do that, they might be more well behaved. So it's a great drug. Tramadol is good. Of course, it's controlled, so it's a little harder to get these days. Medicam is a more cost-effective choice. That'll also help with the inflammation. So that's always a good choice. It can have some effects on the kidneys if they're super dehydrated, so you'll want to make sure they're on IV fluids or sub-Q fluids. And they should be eating, or at least force feed them if they're on that. We talked about mannitol. That helps with the intracranial pressure when they get hit in the head. And then steroids, you know, steroids you want to use per your vet's decision, really. But they can be indicated sometimes, mainly in the end, like if nothing else works. And if they have any broken bones, you obviously want to try to support that. If you don't have somebody who can do surgery at your shelter, you know, you can place a splint. If you don't have a splint, you could place a tongue depressor, you know, on the leg if it's a front leg. Pat it up real well and put a bandage on that. As far as fractures go, and I think this is a huge point in shelter medicine, because everybody thinks, oh, gold standard is orthopedic surgery, and it really isn't. I mean, this is a fundamental for us. Our first choice is going to be try to save the limb and put a splint on it, you know, immobilize it and give it time. Even fractures that don't have a splint on them will heal with time. Now, if it's a really bad fracture, or if it's, you know, a mutilated limb that the bone is popping out and it's super infected, then, you know, that would be the point where you're saying this is never going to heal just because infection is set in. This leg's been broken for weeks. You know, that would indicate amputation. And, you know, if the patient has 3 other good legs, if they're walking great, hopping around, there really is no downfall to removing a leg, you know, and they're actually more adoptable, believe it or not. Now, the third choice, which is going to be the most expensive, is orthopedic surgery. And we reserve this as the last case scenario if they have more than one leg that has been affected, and in a way that, you know, these legs are not going to heal to the point that they're going to be pain-free. So say you have 2 breaks in the front leg, 2 breaks in the back left leg, you have to fix those. So that's when we will raise money for orthopedic surgery. This is the pictures up here. It's a really good example because this is a little kitten that came in with the top picture. I mean, its foot was just mangled and infected. Luckily, it was just the foot, so it was just the toes. And we actually had it scheduled to amputate it, but we put it on antibiotics and pain meds. And by the time we got to it, it actually started healing because this kitten had an amazing foster. And it healed, and so this kitten had a functional limb, yeah, it only had 2 toes, but got around great, didn't need surgery. And that was just cleaning it, soaking it, in like a betadine solution.
Yeah, that had a cost of like $5 of just vet wrap and gauze and Manuka honey.
Yeah. So one of the key things, and I have this a lot, where I'm in the clinic and I have this patient and I'm evaluating it, and it's not doing as well as I want it to, and I'm like, oh, is it really responding to my treatment? It might be a very severe case. He just looks real lethargic. I'm like, is he really giving up? Before I even think about euthanasia, I put some food in front of the cat. And if he eats, there's no way I'm gonna even think about euthanasia, because there are so many times that these cats, they're just so down, they're painful, they're, so stressed out, and I put food in front of them and they eat. I know that cat's a fighter. So if they'll eat, then they have the will to live. Keep on going with them. And it's a better prognosis. I mean, there are very few cats, when they have, when it's a younger cat that has an acute issue like this, if they eat, they're pretty much probably gonna survive. On the other hand, if they have been just stressed out majorly, they're in shock, they just got hit in the head, they might not eat. So in these cases, you treat what you think is the main issue, the swelling, the pain, fix the fractures or whatnot, and reevaluate them, force feed them as needed, put a tube in them. But if they have the ability to eat on their own and you give them the food and they go for it, I mean, that's a great sign. So this was FedEx, and I guess the story was he was found in a FedEx truck engine.
I think he fell from underneath a moving UPS truck, and so we named it FedEx just instead of UPS.
So there you go. Vets don't always get the accurate history. So yeah, that happened, but you can see his skull is showing up there. His left eye was it started to come out, and it was non-viable anymore. I think he also had a jaw fracture.
He had a jaw fracture. He had a front and hind leg fracture. His ears were mangled. He was just disgusting, and he looked like he had been hit by a truck because he had been. And he was about 6 weeks old on that photo on the left when we got him in. And he was a great example of this will to live that we see in cats, because this disgusting beat up creature that looks like a zombie cat came into our clinic and immediately started trying to do elevator butt, and we put a can of Friskies in front of him and he started chowing down despite being in this condition. And we all looked at it and were like, this is how we know that cats will one day rule the earth.
And I mean, he wasn't a super easy case. He had the will to live. He did go through 3 reconstructive surgeries because he didn't have enough skin up there to close over the eye, and then the skull defect. Anyway, he was also anemic. So we were battling with that, so we couldn't go to surgery immediately with him. But all in all, I mean, you see that picture on the right. He's an adorable little kitten. So
I think it's important that we mention too, if we hadn't tried with FedEx, the ultimate decision would have been euthanasia, right? No one would have disputed that. If we couldn't have fixed him, he would have certainly died. So what harm does it take to try? The worst that happens is that the cat dies, and he was going to die if we hadn't intervened. So we may as well try, because a lot of the times they prove us right, like FedEx, and he is happily adopted, and I think he's been adopted by one of our vet techs who nursed him back to health.
Yeah, fell in love with him for sure. So the most common conditions we see in the shelter are upper respiratory infection, anorexia. So we'll go over URIs. Vaccines do prevent most of the severe cases. You do have some resilient types of calicivirus that vaccines will not actually prevent, but for the most part they do. When we're talking about treating upper respiratory infections, a simple, really cheap thing you can do is nebulize them. Frequently, if we have fosters that have kittens that are congested, but they don't have the ability to come to the clinic right then and there, we'll say go into the shower, go into the bathroom, put your shower on hot, and let the kitten just sit in there and inhale the vapor. That'll help break down all that congestion. Force feeding, again, to keep their energy up. And then we usually we have a protocol, URI protocol, that the technicians can follow. It starts with doxycycline. I don't know why private practitioners love Clavamox. They do. It's very expensive, and really, it does not do anything for upper respiratory infection. It might for the really mild cases that probably will resolve on their own, but we don't waste time with it. Plus, it's too expensive. So we start with doxycycline. If the doxycycline isn't working, then we'll go up to azithromycin. Azithromycin is stronger. And then if that doesn't work, then we'll go to Baytril. Other medications you might use are some eye medications, as far as if they have ocular discharge, if they have conjunctivitis and their eyes are swollen shut, you'll want to use some kind of eye ointment or eye drop. And with any of these sick cats, get them out to foster. They'll get better quicker. They'll get more force feeding, more love, just more tending to. As far as anorexia goes, the key thing is to minimize stress. Again, get them out to foster. A lot of the cats that we have in the shelter are just eating because they're stressed out. They'll come to the clinic multiple times. We won't find anything wrong with them. So we do have a protocol for that, which we went over. As far as obese cats go, you think, oh, they have so much weight on them, they're fine. If they lose a little weight, it won't be anything. They're the ones that will get sicker quicker if they lose weight. So these cats, you really want to make sure they're either eating ravenously or keep weight charts on them if you're questioning them, because they can go downhill quick and get yellow if they get liver disease, after a day or two of not eating. We have that not eating protocol. So if they're not eating for 24 hours, we've given them a buffet and everything. We'll start appetite stimulants, sub-Q fluids, and we'll start force feeding them, hopefully kick-starting them to get back on track. I didn't see that. So some other common conditions, diarrhea, of course, we all see it. First thing you want to do is rule out any contagious disease such as panleukopenia. So if you have young kittens, have only 1 or 2 vaccines on board or no vaccines, and they're having diarrhea, make sure you test them for panleukopenia. Usually they're going to have vomiting or anorexia as well, or lethargy, but you always want to make sure that's not a factor. As far as treatment goes, the next thing you want to rule out is parasites. That's the most common thing that's probably going to cause this. So we'll start just a broad treatment of parasites, Panicure, Marquis, and Metro, and that just covers everything. If they're still not improving within 24 hours, we'll start doing more things, such as giving them sub-Q fluids. Penicillin, we found, works wonders. Giving penicillin sub-Q, it helps get the GI tract back. So once a day for 3 days, we'll sometimes turn them around. Sometimes you have to go even into a more severe antibiotic, such as Baytril. So usually they're going to improve on the dewormers. So these ones that don't are kind of what we would call chronic diarrhea cats, and that's when a vet gets involved and we have to really look at everything. Again, stress can cause this. Food change can cause this. So you want to make sure that they're keeping the same diet. If it's a stress issue, get them out to foster, that kind of thing. If they do have a parasite, such as coccidia, if you're giving them Marquis, which treats coccidia, but you're not sanitizing the litter box every time, they can be reinfecting themselves. So that's the other thing. If you're finding that nothing's working, make sure that you start cleaning the litter box daily with bleach to interrupt that parasite cycle. So usually we'll do a step process. We'll start with the most obvious things. So usually we'll do like Panicure and Metro, and if that doesn't work, go to Marquee. But you can do them all at the same time. And then going to neurological issues, this is another huge thing. There are so many cats that come in that are neurological, so they're wobbly, they're circling, they're just not all there as far as mentation goes. And yeah, it could be head trauma. We already talked about that. But the most common thing I think we see is toxoplasmosis, and it's a parasite that attacks the neurological system. And it's super easy to treat. You put them on antibiotic, clindamycin, twice a day for 4 weeks. Usually what we'll do is we'll start the medication, we'll say do it for like 10 to 14 days. And if they actually resolve as far as their symptoms, then we know that that's probably it, so we just extend it to 28 days. I've seen a kitten, it was a bottle baby, so he was really hard to know what was going on, but he didn't want to take the bottle. He was just limp, lateral, but he wasn't fading. His blood glucose was fine and everything, and I was like, man, what's going on with this? And he had an increased respiratory rate. His lungs were okay, though, and so I tube fed him, got him on IV fluids, gave him IV clindamycin, and within 6 hours, he was taking the bottle like a normal kitten. So he was one, and I was almost going to give up on this kitten because I was like, I think he just got hit by a car, he's having respiratory issues. But I said, let me see, maybe it's toxoplasmosis, and it was. So, they can present oddly, but clindamycin is wonderful. Ear infections can cause neurological issues, more so circling. If you see an animal that's circling or has a head tilt, it's mostly probably an ear infection. Cerebellar hypoplasia, I'm sure you guys have heard about that. There really isn't anything to do other than, just symptomatically treat the cat and give it quality and love. And as far as rabies goes, and this is really important, we don't euthanize. So rabies can be a differential for any neurological disease. As vets, we're taught that. They really scare us. But it's important. There are all these other things that it's most likely going to be. So if we take rabies and say, okay, there's like a 2% chance that's what it is, and euthanize them, we're not doing anything for that animal. So we don't euthanize them if we suspect it's rabies, because we suspect it's all these other things. We give them a 10-day quarantine period, make sure anybody who's in there is very careful. There's a handful of us at the clinic that are rabies vaccinated, so it might be something like, okay, only these people, touch this cat. But there have been a lot of cases we've thought maybe it was rabies, and we've sent the animal in for testing. It never comes up rabies positive. So, and a lot of shelters hold this against cats and say like every fractious feral that has something going on has rabies, and don't give them the chance. So to minimize costs, when you have more chronic conditions, these animals that aren't gonna, ever be 100%, that you have to treat lifelong. Feline leukemia is one of them, and Monica had a good lecture on this. I don't know if anybody attended, but we treat felvies, as the symptoms come. They're healthy until they're not. So, it's not something to hold against them if they're doing fine. So we will treat them if it's something we can treat. We had a cat that had a diaphragmatic hernia, within the last month, and he had respiratory issues, and so you could say, well, it's felvy, maybe he's end-stage felvy, or he's got some other infection going on, like FIP or whatnot, or lymphoma. Well, we took a radiograph, and it was just his diaphragm. So he got hit by a car or, you know, some other kind of trauma. Took him to surgery. He did great. So, you know, that's something we can treat because the diaphragmatic hernia was the main issue. We didn't hold the felvy against him. Now, if it's a felvy cat that, you know, he's come in, he's losing weight, he's not eating, gums are pale, he doesn't really have anything else going on, well, we can say, okay, that cat's an end-stage felvy. You know, he's showing all the symptoms. We're not going to try any heroics. We're not going to do blood transfusions. We have a lot of these cats in foster, and we do, at APA, we offer some treatment to adopted felvies. But they know, you know, we're only going to help them with felvy-related illness, and when it comes to end-stage disease, you know, we're there to offer euthanasia for them, to help them out. But we don't do any heroics. As far as chronic diarrhea goes, we kind of covered a little bit of that. Penicillin works. I'm not sure why, but we've seen it work. Different foods. I mean, some cats are just sensitive, you know. Some cats vomit on a lot of different, you know, on one type of food, but are totally fine on another. Same thing with diarrhea. Probiotics help. You know, I wouldn't spend a ton of money on Fortiflora, but if you've tried everything else and you do like a 10, 14-day trial, you know, it's worth it. And then again, foster, send them to foster. It might just be stress. Allergies, and this is probably one of the toughest ones, I think, in the shelter. You know, you want to make sure you rule out all the other infectious causes, such as Sarcops, Demodex, ringworm. Make sure you got that all ruled out. And then foster again, because they might have a stress, say, stress causing them to overgroom and that kind of thing. Food trials would be the next thing to do, but that can be costly. So you have to really be careful with that. But if you have a foster who's willing to go buy food and you can have a vet that writes them a prescription, you know, that's usually the way to go. Other than that, there are some medications you can give to them in the meantime to help with if they have skin allergies, they're itchy, if they have, you know, really bad diarrhea from intestinal allergies and that kind of thing, like a steroid, but that would be, again, up to the vet that's working with you. Kidney failure is another thing we see a lot since we take a lot of these sick cats from the shelter. Again, these cats are kind of the same thing. They do well until they're not, kind of like the felvies. So, you know, they're going to have a bit of time until they all of a sudden go downhill, and then there's nothing really you can do. Again, we don't use any heroics with these guys. We help keep them hydrated with sub-Q fluids if they tolerate it. I think that's a huge thing. If a cat hates to be poked and prodded and hates oral meds, we're not going to force this on a kidney failure cat. It's basically we want to keep his quality there, so we do what we can. In our program, we do offer a renal failure adoption incentive where we will say, if you adopt this cat, we'll give you sub-Q fluids for life and kidney food if we have it donated. But mainly wet food is what we recommend. We'd rather them be on wet, regular food than dry kidney food because of the moisture content. Diabetes, that's another challenging one. I don't know how many other shelters treat as many diabetes. Does anybody treat diabetes? Awesome. That's great. So we have a handful of diabetes cats. We do have some good fosters. I mean, and that's really where you want them. It's a struggle to keep their treatment regimens correct, you know, giving them insulin, making sure they're eating. We tried to go over to a diet-only treatment process and see how that went, but inevitably, some of them always need insulin. So it's a challenge. But if you can get them in foster, get somebody who's educated enough to give them the insulin, know when they have symptoms that, you know, need to be reported and that kind of thing, they're totally treatable. We do use donated insulin. We have a lot of it, actually. So that's something, as long as they bring it to you, it's cold, you trust the person that brought it to you, you could still use it. Now, if it's not working and the animal's still having, spikes in their glucose, you may want to revisit that and say, well, let's get another bottle that's actually, new. Hyperthyroid cats, we don't test for this just because of the cost of it. We might do one initial test just to diagnose them, but then after that we go by clinical signs. So clinical signs in a hyperthyroid cat, they're going to be super ravenous, usually. There are some that will not fit that. But most of them are going to want to eat everything. They're going to be skinny. They're going to have a lot of energy. They're going to be jumping around, hyperactive. And their heart rate's going to be high. So that's usually how it is. Some of them don't, do that, though. But basically, we would start medication and then, increase it or decrease it based on those symptoms. We also, going back to diabetes, we also have some patients that are diabetic where we will increase or decrease their insulin based on their clinical signs as well, because as you guys probably know, a lot of these cats don't like coming in for glucose curves. So we'll teach the foster or the adopter how to do that and go from there, or we'll go by clinical signs. So if they're urinating a lot, if they're eating a lot, that kind of thing, usually it means that their glucose is too high. And then heart disease. So these are cats that, have congestive heart failure due to some reason. There are a few ways to go. Furosemide, I think like I said earlier, this is going to help them in general have a better quality of life. That's cheap. That's the cheap way to go. Pimobendan is more expensive. That's going to extend their life and that kind of thing. We just want to, let them have a good quality of life. So if you have a cat with a murmur that's showing signs of heart failure, just go with furosemide.
Okay. Let Dr. Bars take a breath there for a second. So how are we going to provide for all these medical cat needs and still do it within our budget? The first and most obvious choice is you have to get these cats out of your clinic, out of your shelter. Every single day that a cat is in a cage at your shelter has a very tangible cost to your building, to your organization for care provided and all the resources that she's using. You've got to use volunteers. There's absolutely no reason a volunteer can't work recovery in your clinic, work surgery recovery, can't come in and syringe feed cats, can't give vaccines. There's no reason a volunteer cannot do these things. Just train them up like you would a staff member and put them to work. So there's a couple fun things in here that Dr. Bars is going to give me the side eye for, and one of them is that vets must seed control. And I know that this is a big issue because I work with all of you shelters. That means that your veterinarians in-house have to stop pretending that every single cat in the world who is sick must stay under their care and no one else in the world can possibly take care of it. You've got to seed control and say, I've done my part, now I'm turning over the rest of the care to someone else, to a foster, to an adopter to do. You cannot save all these lives and have every single cat in your care for every single minor detail. Get it stable and then get it out. So basically our rule of thumb at APA is as soon as it is stable, it is leaving the medical clinic. And sometimes our own vets even don't like that because we all want to protect them and keep them safe, and only I can do it the best, right? But you can't help the next cat who needs that cage unless you're willing to seed control and send that stable cat out to foster. Educate and train your fosters and your volunteers. So, hey, you need to give sub-Q fluids, you need to give diabetic insulin injections. Great, we'll teach you how. You need to learn how to express a bladder. We will teach you how. There is no one we will not teach how to do something if you will take a medical ICU cat home for the day. Chip-ins and GoFundMes, like we talked about with Sam, we are really big on those, and there's a lot of times, like I said, we will not be able to go forward with the surgery until we get those chip-ins met, and thankfully we're able to do so. Something else that helps us balance our funding is exploiting these opportunities that raise money. So these were our brush fire kittens in Austin. A whole litter was found accidentally lit on fire in a controlled brush burn in Texas. And as soon as the person who lit the fire discovered these kittens, he rushed them to us, and it was a whole litter of these kittens. And we exploited these kittens. Not afraid to admit that. We exploited them because it's such a sensational story, and they did need thousands upon thousands of dollars of care and surgeries to fix these kittens. This was a little kitten named Lightning. That was him before and after some of his surgeries. Certainly it was lots and lots of money, but nowhere near what we raised. And that money was able to go towards the next animal who didn't necessarily have such a sensational news story that we were able to use those funds for. This is Maddie Moody. He was another cat that we were able to exploit his misfortune to help him and other cats who didn't necessarily have such a sensational story. So he's a great example. This was him on the left at his sending shelter and how he presented there during his enucleation surgery in the middle, and then his adoption photo on the right. So enucleation surgeries, because we have Dr. Bars and her team in-house, these cost us literally nothing to do, a couple dollars of supplies, but it certainly looks sensational, and we can appeal to folks' sense of sympathy. And I think we raised several $1,000s for Maddie Moody, and then that goes forward to paying forward that medical care for cats and dogs who don't necessarily have such sensational stories. So don't ever hesitate when you get a Maddie Moody or when you get a little brush fire kitten, and don't hesitate to exploit them. They're helping pave the way forward for the rest of their brethren.
And blind cats do amazing. I don't know how many of you seen a bilateral nucleation cat. They do amazing, despite what everybody thinks.
Yeah, it wasn't like he was using those eyes on the left anyway, right? Yeah. And so this is Dr. Bars' favorite slide of the presentation. I spend my day, as the Maddie's director of feline life saving, I spend my day going around to other shelters and helping shelters everywhere save the lives of more cats. In layman's terms, I feel like I spend my entire career arguing with vets. And I love my vets. I love Dr. Levy. I love Dr. Bars. This is a big problem within animal welfare, though, right? But my vet says. Yes. Can you force somebody to care? No. I can't force somebody to care. I can't force somebody to say, we're not going to euthanize this feral cat with ringworm just because we don't want to deal with it, right? I can't force them to care enough to say, I care enough about feral cats that I'm not going to euthanize, right? But I can make a protocol, I can make an SOP that says, we do not euthanize for ringworm. Every cat with ringworm will be treated. Here is how we treat ringworm. Here's our euthanasia protocol. Here's what we will euthanize for. Here's what is unacceptable reasons to euthanize for. And so I know a lot of us are dealing with veterinarians or any level of staff. Maybe they're more dog, maybe they're more cat, maybe they don't like ferals, maybe they don't like big bully dogs, whatever. But if you have a loophole that allows them to pick and choose which treatments apply to which animals, you're going to have a life-saving gap where these animals sneak in unless you have a euthanasia policy, unless you have a protocol that says unacceptable, everybody will get the same standard of care based on them as an individual, not based on some personal criteria. So having a euthanasia policy, having treatment protocols, having position statements will keep your vet staff, your vet tech staff, and get all that kind of resistance a little bit in line. And then lastly, Austin was not always, this mecca that we think it is. 10 years ago, we were killing 50% of the cats at our community. And our private practice veterinarians in Austin did not used to be so kumbaya with Austin Pets Alive either. 10 years ago, we would send a parvo dog, post-parvo dog out for adoption, or we would send a cat with a ringworm out for adoption. We would get the hateful phone calls about how irresponsible we are, and oh my God, you're giving Ebola to the public, and this didn't happen overnight, that now we are suddenly able to send 10,000 ringworm cats out into the community every year, and the local private practice just accepts it and deals with it. We have cultivated them over the years, and we have gotten to the point where we are pushing now 10,000 animals a year back into the Austin community, and they are all post-parvo, ringworm, messed up renal failure cat, feline leukemia cat. The most broken of the broke things are what we specialize in Austin Pets Alive, and 10,000 animals a year are being pushed back onto private practice in the Austin community. So what does that mean if you're a private practice vet in Austin? You either get on board or you go out of business, right? But we want to help those nice vets who align with our mission. We want to send them our business, so we provide our veterinary clinics offering a free exam to our adopters, and we will only put vets on there who align with our mission. So you won't find any vets on here who declaw cats, for example. And we will tell you, we will not recommend you. I'm sorry, we cannot work with you. Thank you very much for your offer, but we will not partner with you because your mission does not align with our mission to protect and advance the welfare of cats. On the bottom is a little text message that happened recently, and this is between me and our director of development. So she's the one who's responsible for getting us all these nice monies. And we had heard from an adopter, they went to a private practice vet clinic, and the vet told them that we are irresponsible, APA is irresponsible for putting out feline leukemia cats for adoption, and they should all just be killed to save potential hurt feelings. And oh, by the way, but we'll be happy to declaw that cat if you'd like. And so our director of development replied and said, what? I hope they're not on any of our lists for recommended vets. I'm basically going to call them up and tell them we're never partnering with them until they change their tune. And so we have actually taken the proactive stance of calling you up and saying, hey, FYI, we think you stink. And until you change X, Y, and Z, don't expect any of our 10,000 adopters a year. Thank you very much. When you change your ways, or if you would like some education, please let us know. We'll be happy to send our vets over there. You have to talk to our ED, and then we can partner. But we do not align in mission, and so FYI, don't call us ever again, and we will never send anyone to you. Thank you very much. Goodbye. And that is how we have cultivated the community over 10 years. And similarly, when we have a private practice vet who says, I love feline leukemia cats, I'm so happy you're doing this, oh, I'd love to see your ringworm cats, I want to support your mission, I think what you're doing is great, we go out of our way to say, you rock, you are in line with us, we're going to send our 10,000 adopters a year to you. And that is how we have cultivated our community over the last 10 years. This last photo here, this is Super Sully. This is the cat that you saw all hit by car and his eyes bulging out and gross earlier. This was him in his foster home. He's long since been adopted. He's absolutely great. But I wanted to make available to you this website, maddieslifesavingacademy.org. If you go to that website, you can download all of our medical protocols, our SOPs. They're all free for you to download. Don't reinvent the wheel and feel like you need to come up with all these SOPs on your own. Please feel free to steal ours, take our logo off the top, put yours on. That's what they are there for. And then secondly, if you are interested in more feline life-saving, I want to encourage everybody to visit that website and sign up for an apprenticeship through Maddie's Fund at Austin Pets Alive. Through Maddie's Fund, they will pay you to come spend 3 to 5 days down with us in Austin. All expense paid internship with us, so you can apply right there for feline life-saving. We've also got some clinic apprenticeships open for veterinarian and clinic manager and more medical side of things, as well as just cat life-saving. So don't forget to hit up maddieslifesavingacademy.org and check out those resources. And then I don't know if we have any time for questions or not. No? Yes? If we don't, feel free to come up and get my card if you have questions, and I'm just going to answer questions until they throw us out. How about that? Who has questions?